Paying so little attention to our vaginal health is unacceptable, but many women do. Sorry, ladies, but this is the truth. You must despise it when your vagina behaves strangely, correct? However, how often have you told yourself that your poor vaginal health and smell are due to your actions? In this video, we will cover female hygiene tips you should know. Women should only discuss genitourinary concerns. Most women make the mistake of not speaking or exchanging thoughts regarding vaginal health. Vaginal health issues are frequently untreated as a result of this misinformation. We all wish we had known these things sooner to take better care of our vaginas. So here's to better health, and let's cut to the chase. Number 1. Take 2 showers per day. Women should always finish their showers by properly washing off. Beatrice advises ladies to practice good personal hygiene by taking 2 showers daily to wash away the filth and chemicals they come into contact with during the day. Remember that your skin is a living, breathing organ that absorbs the essence of everything it comes into contact with, including potentially hazardous chemicals. Water and our plant-based personal hygiene products are the best way for women to prevent the transmission of germs. First, try one of our regular or gentle feminine washes. Number 2. Don't forget your probiotics. Probiotics have numerous advantages. Taking a probiotic daily has been demonstrated to assist in the control of various internal systems and processes within the body, ranging from increasing immunity and digestive function to curing skin and gastrointestinal issues. Probiotics have been shown to help maintain normal vaginal pH levels and prevent and treat UTIs. You won't have to worry about your pH levels shifting if you take it every day. You can call it whatever you like, but trust us when we say it works. The key is to keep a constant focus on vaginal health. Number 3. Let it breathe and dump those panties. Almost every woman on the planet now wears underwear, and the majority of them also wear pantyhose. Going commando, on the other hand, has been shown to reduce the risk of yeast, inflammatory, and bacterial overgrowth by limiting the accumulation of additional moisture. If you can't endure a day without your trusted glasses, try going without them while sleeping and see how you feel. Number 4. Remember a healthy diet. Ladies, it is true that effective feminine hygiene care begins with what you consume. The foods and beverages you eat regularly can impact the smell, taste, function, and feel of your vagina. What goes up must come down. So why not properly fuel your body to attain maximum potential? Fruits, veggies, and healthy, pure foods will help keep your body in check. A healthy diet is essential for the entire body, including the genitalia. Probiotics or healthy bacteria are beneficial to vaginal health and can be found in foods such as yogurt with live cultures. According to research published in the Archives of Internal Medicine, taking a cranberry supplement daily may help prevent urinary tract infections. Number 5. Some lawn maintenance advice. Regularly cut the grass. We don't wish to belittle our fellow bush beauties, but we also don't want to minimize the necessity of keeping your honeypot in good working order. It all boils down to the relationship between moisture and fragrance. Because of the increased moisture and odor, having more hair down there increases your risk of yeast infections and bacterial vaginosis. Manicured honeypots are happier and healthier, whether you go for a bald eagle, a low fade, or even shaving the hair around the labia. Number 6. Make sure your genital parts are always dry. Your vagina produces these fluids to maintain a balanced environment for itself. A consistently moist climate, on the other hand, invites mold and mildew. As a result, you must take efforts to remove any extra moisture. These are some examples of such actions. Wearing cotton underwear will allow your skin to breathe. Taking off wet or sweaty underwear or swimsuit. Changing tampons or pads every 4 to 6 hours, or emptying your menstrual cup every 4 to 6 hours. Number 7. Avoid using soap and the douche. The vaginal cavity performs an excellent job of sanitizing itself. It keeps the pH stable to prevent the spread of disease-causing microbes. The use of solid or scented soaps, as well as douching, rinsing the inside of the vagina with water and soap, can alter your body's natural pH balance. If the delicate vaginal balance is upset in this way, you increase your chances of infection. Use warm water and no soap to clean the exterior of your privates. Wash the vaginal area with regular soap and water preferably lukewarm water. While vaginal hygiene is essential, use gentle, unscented soaps rather than harsh ones. Soaps containing potent compounds such as glycerol, fragrances, and antiseptics may disrupt the delicate balance of the vaginal microbiome. Furthermore, it can change vaginal pH, causing irritation and encouraging the growth of pathogenic microorganisms. Number 8. Get it clean after sex. When couples engage in sexual activity, body fluids, lubricants, condoms, toys, and other erotically generated detritus can spread germs and other pathogens in and around the vagina. To reduce your risk of infection, take a shower or use wet wipes to thoroughly clean and dry the outside of your vagina. A trip to the bathroom is necessary to eliminate any foreign matter that may have entered your body during a sexual encounter. Number 9. Think before you shave. Women frequently remove vaginal hair because they are self-conscious about it or believe their partners will. Pubic hair is required to keep the vulva free of germs and other harmful substances. Because razors, wax, and other hair removal methods irritate or cut the skin, you increase your risk of infection. It's better to keep pubic hair trimmed rather than completely removed. Number 10. See your gynecologist every year. If you are concerned about your sexual or reproductive health, you should consult with your doctor. Women, in particular, benefit from preventive health care, such as frequent wellness screenings. You should schedule an annual consultation with your gynecologist to ensure that you are receiving regular pap smears, mammograms, and sexually transmitted disease (STD) screenings. If you have any concerns or questions about your sexual or reproductive health, this yearly checkup is an excellent opportunity to address them. Number 11. Infection symptoms should not be ignored. You are the only person who truly understands your intimate relationship with your vagina. If you are concerned about your health, contact your gynecologist as soon as possible to discuss potential symptoms. If you have any unusual vaginal symptoms, such as itching, redness, pain during intercourse, or overall vaginal soreness, a strange or pungent odor, excessive or discolored discharge, lumps, or a rash, you should see a doctor. If you notice any of these symptoms, see a doctor immediately. You could suffer from an infection or something more serious. Number 12. Never use old towels. Towels and washcloths should be washed and discarded after each use. Towels should not be reused due to the persistence of microorganisms, and this may put you at risk of becoming ill. Number 13. Do not get your underwear wet. If you do not wipe the vagina after urinating, the panty liners will become moist, resulting in a foul odor and putting you at risk for vaginal infections. To keep your underwear dry at all times, use toilet paper or a soft cloth to wipe the area. There will be fluid or discharge if the vaginal environment is healthy. Using talcum powder or wiping the vaginal area too frequently and vigorously can cause itching and dryness. It may also make it more susceptible to injury and cause discomfort during sexual activity. Furthermore, many studies show that using talcum powder in the genital region may increase a woman's risk of developing endometrial cancer. Number 14. Change tampons or pads every 4 to 6 hours. According to Dr. Nupur Gupta, a gynecologist in Delhi, women with regular menstrual cycles should change their sanitary napkins every 4 to 6 hours. The same is true on days when your blood flow is low. However, if you have a heavy flow during menstruation, you must change your sanitary pads every 3 to 4 hours. If you use a tampon, you should change it every 6 hours at the very least. It is critical to keep the restroom clean, especially if you are menstruating. Long intervals between sanitary napkin or tampon changes can cause skin irritation and an unpleasant odor. It can sometimes make you susceptible to diseases. Furthermore, some women prefer to use cloth pads, which can be washed and reused between periods. Number 15. Wear comfortable clothing. Perspiration is unavoidable when wearing tight garments and inners made of synthetic fabrics due to decreased air circulation. When bacteria and yeast thrive in warm, damp environments, such as those created by excessive sweating, vaginal infections can develop. Experts recommend cotton underwear due to its breathability. Wet swimming suits, spandex, and anything of that sort should be taken off and washed as quickly as possible. Number 16. Wipe the right way. Is this the proper method for cleaning the surface? Okay, that's most likely not the case. When cleaning the vagina, work from the vagina to the anus, not the other way around. That is due to the increased risk of bacteria being transferred from the cervix to the vaginal canal if the order is reversed. As a result, if you've been wiping in the wrong direction with a towel, you should switch. So there you have it. Now that you ladies know these lovely tips, remember that it is excellent to talk about vaginal health. Don't be shy. Do you have a feminine hygiene tip that is not on our list? If so, let us know in the comments below. If you like this video, don't forget to like and subscribe to our channel for more healthy tips. Thanks for watching and see you soon in the following video.